Hello, hi, good afternoon. We are in another session of RevitaLive. Today is the 5th of May, and today I'm very excited because we have my dear colleague, Dr. Mohana, consultant orthopedic surgeon from Gleneagles, Penang. And as you can see, we are maintaining our social distance, keeping abreast with the current situation with the COVID virus and so on. So we hope that all of you all are safe out there, and you all have had your lunch. Mona, how about you?
I've had my lunch. I had a surgery today, so I had something to eat in the operating room.
Okay, excellent, excellent. So, what's the current situation with the MCO and everything now that we are? I think certain states are lifting it, and Penang we are supposed to lift it on the 8th. Your thoughts on that? Anything?
Well, I think they've done. I think the ministry has done a very, very good job. So has Gleneagles,
Right.
and we have pretty much followed everything that they've asked us to do.
Right, right.
Wearing my mask. I'm just removing this mask just for this session. Otherwise,
Yes.
I'm on my mask all the time.
Correct, right.
And social distancing.
Yep, yep.
And keep yourself clean and safe all the time.
Simple steps like hand washing and so on. I think it's important. So as you guys can see, today our topic is, as you can see up there, what your weight matters or what your weight means for your bones. Okay, and as I said, we are very lucky and fortunate to have none other than Dr. Mohana to talk to us about healthy bones, and as well as how obesity or excess of weight can cause a lot of problems for for your joints as well as your body structure. Okay, so getting to it, Mona. Currently, I think we keep repeating on the show every week. Malaysia is, the number one country in this region for obesity and overweight. I think about almost 1/3 or almost 2/3 of the population are in the group like either overweight or obese. So, what do you think is the driving force to cause this problem?
Well, if you see, I think when we have now moved into becoming a developed nation, we are moving towards that. So as you go on becoming more and more developed, your access to a lot of things, your lifestyle, access to food outlets. So nowadays you don't even go out; you sit at home in order meal. So the mismatch is quite a bit. So I think it has become quite bad now. Intake is more, burning of calories has become less.
And caloric imbalance, like what you say.
Yeah.
Right? And then I think now it's even more worse because currently we got no choice. We have some of us have to order Food Panda, Grab, and all that such. So food again comes to you rather than you going for the food. And second part of it is we can't exercise as much as we want to.
That's right.
There's a lot of us are staying at home, but of course now we are coming out of it to some extent. And I think in Klang Valley, if I'm not mistaken, some of them have already started like going out and exercising and so on, jogging and so on, right?
Yes.
Okay. So Mona, how about in your field, right? Do you see a lot of patients who are obese currently?
Pretty much now, it's much more than before. In the past, I would say the past 5 years, there have always been a group of people who is obese, overweight, obese. But now in the past 5 years, I see more. That's because of what I just said. Lifestyle has changed, and in the last 2 years, there has been a drastic increase.
I see. Okay. And because to me, when we were all undergrads and so on, a lot of diseases of old age, like osteoarthritis, debilitating spinal problems and so on, we used to associate with disease of age. But currently, apparently, they are happening at a more younger age group because of the overbearing of weight on the thing. So maybe your thoughts on that. What are the diseases that is accelerated because of the obesity pandemic, and what our viewers should be concerned about accessing weight to their joints later in life?
Sure. You see, I think I will just simplify it for them.
Yes, please.
So if you're looking at problems of obesity to the musculoskeletal system, that means to the system of our body, basically we're speaking about bones. So the first thing is what obesity does to the bones, as in the strength of the bones. it has been proven that obesity decreases mineralization of the bone. That means it decreases the content of calcium in the bone.
I see.
So, in other words, in simple terms, osteoporosis. Right? So, when you have weakened bones, with bones that are not so good, that are more brittle, you have more fractures as you age.
Yeah.
So, it's easier for you to get a fracture, a broken bone.
Right.
So, when you have a fracture, there comes all the complications that come with it.
Nice.
Healing is slower.
Right.
If you operate an obese patient, it's there are other complications that come with it.
Yeah,
So that's number one.
Okay.
That means as in the structure of the bone. And what I commonly see, 90% of the problems are the issues with the joints.
Right.
I said it starts from the spine. Problems of the spine. There's a word that I'll probably use, degeneration. Basically, your degeneration increases. Right? So your bones get degenerated faster because of the effect of the weight on the body. Spine, hip, knee, ankle, and the feet. There are many joints in the feet itself that actually get degenerated. So they normally present with pain.
Right. I think that's why a lot of people, because of their, because of the assumption, they feel that those who are obese have too much of calcium or have a lot of minerals in the body, so they don't need to be worried about that. But in actual fact, probably it may not be enough. They may be having lack of it actually.
That is what we used to think before, including the doctors. We used to think that, I'm big size,
Right.
so I actually have more calcium. It's not.
Yeah.
It has been proven otherwise now.
Okay. And then, as you said, degenerative. So we are humans, so we are standing erect. So gravity is working downwards. So there's a lot of stress, as you said, in all the joints that we are having as well.
Yes.
Right.
Yeah.
So, what do you normally tell your patients, when they come to see you, because of overweight and so on? So, do you have a treatment plan for them of how you approach certain diseases and so on?
Well, if you look at patients with, we'll pick maybe one joint out of all the joints.
Right.
Knee joint. Let's take the knee joint.
Okay.
So osteoarthritis of the knee. Osteoarthritis means it's degeneration of the knee. It commonly occurs in old age. It's an old age group disease.
Right.
But nowadays I'm seeing it in younger patients. And number one cause in the younger patients are generally because of other arthritis. Number two cause is weight. Obesity.
Right.
So when they are obese, you tend to have faster degeneration. So the treatment plan for these patients, the first thing is lifestyle modification. Okay. That means you modify. That means you're being very sedentary. You're not a person who walks. I even ask them to take steps instead of the lift, the elevator. So they actually think so lifestyle modification, weight reduction, which I send to you sometimes for weight reduction.
Correct.
So weight reduction, and then some of them have medications, glucosamine, some tablets, sometimes painkillers, and injections to the knee. And then there are certain steps where we do surgeries if required. But there is nothing that you should actually concentrate on lifestyle modification and weight reduction. Sometimes you don't even need step 3 and step 4. That means if you modify your lifestyle, change your exercises. Sometimes I have people who come and tell me that, doctor, I'm obese, and you're asking me to do maybe run, and my knees are more painful. So I actually modify. I change it to maybe swimming exercises, cycling exercises, and weight reduction. So now that I send them to you to sort their weight. So what sort of plan do you do for their weight reduction?
Yeah, actually, good question, Mona. Because to us, in terms of losing weight, first thing is the base. If you look at it like a broad pyramid, the base has to be really strong, the foundation. So the foundation for any weight loss is going to be your diet. What you eat or what components that you're taking in your diet is who you are. So if you don't stick to a proper meal plan, whereby you abuse yourself, you're taking too much of, let's say, very high fat component or a lot of carbohydrates, where you tend to store a lot of, energy inside. As you know, most of this energy that you consume, if you're in a 2,500, which is quite ideal, 2,000 to 2,500 for the 60, 70 kilo individual, is probably ideal. But if let's say you're taking 3,000 calories or 5,000 calories, like what is happening these days, when people are taking a lot of carbo-loaded sugary drinks, food, and so on. So they get stored, and then they get stored in certain places like in the liver or as visceral fat. Okay? And basically what happens is it becomes stubborn. Very difficult for you to actually lose it later on. This is making it in very simple layman language. So first is by changing your diet habits. So you take a lot of fiber and you start cutting down. We have a regime by calculating how much is your caloric requirement for the day based on your energy expenditure. So if you're working in the sector, let's say agriculture, you have a lot of labor work, you're a mechanic or so on, so probably you'll expend more energy. You need more energy, so probably your intake will be higher. But if you're like us, Mona, where most of us are blue-collar workers, where we are probably or white-collar, sitting in the office, we're in the aircon, we're not doing much exercise, we're just doing computer work and so on. So definitely there has to be a limit. So the problem is when everybody tries to take the same amount, and that's why we have a lot of problems. The next step after that is a planning exercise regime, like Mohana has said. If you are probably keen to go jogging in the evenings and so on, but it doesn't permit it because your knee is already so withered and worn out already. So as like what Mohana said, probably you need to go on some resistance in terms of maybe aquatic exercises or swimming, which is ideal, right? Or cycling. And the next step, of course, that we have in our what I call as in our choices that we have for obesity or for overweight patients, we have pharmacotherapy, where we give you medication to cut down to increase your feeling of satiety. That means you start feeling less hungry, you feel more full. You can have it in tablet form, you can have it in injectables as well. The next step, of course, will be the intragastric balloon, where we have a balloon that can be filled and sits in your tummy, and basically restrict the amount of food that you can take. And all the while we have options for this as well. You can have it either placed endoscopically, or you can even place it by swallowing. So for all these procedures, you have indications, who is ideal for it, and you have choices that is not suitable for certain people. So we have to be very selective in our option. And of course, the last thing, Mona, whereby we do surgery, which is called bariatric surgery, where we can reduce your weight by doing certain maneuvers, by restructuring your GI system, or even making your stomach smaller. So these are the options that we have. So coming back to the cases that you see, Mona, for example, like osteoarthritis of the knee. A lot of our patients, probably when they're overweight, they tend to seek, they start putting some ointments in the knee, and then probably they'll come and see you, and probably most of them will not be comfortable to go for knee replacement surgery so fast. So in that situation, is there conservative maneuvers that you can advise for these patients?
See, the first thing is that when the patient comes, they should not come in with the idea that they should have a surgery.
Yes.
Surgery is always the last resort.
Okay.
So as I told you, lifestyle is always lifestyle modification. The thing should come from the person.
Yes.
Right?
Yeah.
The doctor is just there to help you out.
Correct.
So the person has to modify the lifestyle. That means they should have done already that many steps of walking a day,
Right.
even before they think of medication.
Right.
Or even exercises.
Yeah.
So it's lifestyle modification, weight reduction. These are the first two things.
Right.
That is really
I
important.
think we used to say the same thing in approaching a patient who's obese or overweight in general as well. The first thing
Yeah.
is diet and exercise.
Yeah. So when these things are sorted out, number one is they may not need many other things that I just told you.
Right.
Or if at all in the future, let's say in 10 years they need a surgery, it makes the surgery much easier.
Right.
The success is better.
Okay.
Right? So you ask me how do I approach, what do I do?
Yeah.
So there are a lot of medications that they can take, like probably some of them would have heard glucosamine,
Yes.
which is quite safe,
Yeah.
quite reasonable to take, and based on how bad the knee is, it works to some extent. Painkillers I don't like to give all the time,
Right.
so they take painkillers on and off. Right? And over time, painkillers, the usage of painkillers must come down.
It wears off, I think.
Yeah, and it must come down. Okay?
Is there a role, Mona, for taking glucosamine as a prophylactic or prevention for degenerative diseases of the knee?
A lot of them do take,
Yeah.
but I actually tell them don't.
I see.
If you don't, to me, I would put it this way.
Right.
Right? You are a surgeon. Is
Right.
there a role in removing the appendix?
Yeah. Only when indicated.
Only when indicated.
Yeah.
So if you don't need to take a medication, please don't do it. Let a doctor start it for you.
You heard it straight from Mona, right? I think a lot of us tend to, especially nowadays when information is accessible, everybody tends to take a lot of supplements in terms of vitamin, bone protection. I think when you go out there, multi-level marketing, there's so many products that are available. What's your advice?
I normally tell is if you have something like, let's say for the strength of your bone, right? For the strength of your bone, if you require medication, I normally do a calcium level. I normally do a DEXA scan. If those things do not fall, if the patient doesn't fall in the category, and I normally don't give them those medications. Repeat it in another 2 years, and if the levels are low, then you can stop. So there's no prophylaxis actually. I tell them don't take it prophylactic. The only thing that you can do prophylactically is exercises and keep your weight low.
Excellent advice. Another thing, Mona, in Malaysia, I think we have a lot of sunlight. So we don't have this thing called vitamin D deficiency. Whereas our Caucasian friends, Europeans and all that, because of certain time of the year, lack of sunlight and all that, there's a lot of vitamin D deficiency. So they tend to present with a lot of bone weakness and so on. So they take a lot of supplements. So that is not necessarily the same for our population, right?
Not necessary, but there are large group of people where the vitamin D is low.
I see.
Here, even now that we are picking up,
Yes.
those people we do give high dose of vitamin D for the first 3 months,
Right.
up to 50,000.
Oh wow, that's
I do.
Yeah.
Up to 50,000 every 2 weeks or
Okay.
3 months we give them, and then after that it stabilizes,
Right.
and then they take a lower dose.
Right.
But the thing is, if they expose themselves to 20 minutes sunlight a day, the problem solved. So do not think of popping a pill when you can get it for free outside.
Exactly, yeah. I think a lot of people also will feel when they're out in the sun, it's not good for their skin and so on, sunburn.
Yeah, but actually it gives you good vitamin D. Now back to what you asked me just now, what I do. So I also do some injections in the knee.
Oh, okay.
If it is necessary, I do an X-ray and I see in the X-ray that we have gradings for how bad the knee is.
Okay.
Not everybody requires.
Right.
So if the first 2 levels are already there in the treatment, and then glucosamine, I do some injections in the knee if required.
Right.
We call it hyaluronic acid.
Oh, right.
Some of them call gel injection.
Gel injection, yeah.
If it is required.
Right.
And then some people, they require sometimes a small surgery. Put 2 holes, like how you do an endoscopy for here.
Yeah.
We do an arthroscopy
Okay. Yeah.
before a knee replacement.
Knee replacement. So basically, what we have, the joints is basically like this, right? So you
Yes.
have actually the upper part, which is your connected to your femur bone,
Yeah.
and then your tibia below that. So for what most people understand is that the shock absorber in the bone itself is gone. So basically, the bone is rubbing each other.
Yes.
So you're injecting fluid inside there to actually, like hyaluronic acid, to actually kind of
Lubricate it.
lubricate it.
So it's a space like that,
Right.
bone and a bone,
Right.
and in between these two you have a cartilage.
Okay.
So when we say arthritis, when we say degeneration, it's degeneration of the cartilage,
Right.
right?
Okay.
So this degeneration, actually it is not reversible.
Oh.
So when we give them treatment, we want to minimize it from becoming worse.
Okay.
So when we inject it, we hope that it improves the function and they form more.
Yes.
And it doesn't become worse. But you see, if you have a bone that is knocking on the bone below,
Yeah.
right? If you decrease the weight up here,
Yeah.
the knocking is less.
Yeah, correct.
We come back to what we were discussing.
Yeah, yeah. So that's why weight reduction, I think, is one of the foundation again, based on the pyramid. The first step that we take to actually reduce the impact on your joints, right? So, Mona, we have some viewers who are watching us. Probably we say hi to them. Hi.
Hello.
Yeah, Lenny, Chrisanti, Roy, hi. Min Farahani, who always joins us every week. Alice Priya, Sarah Albert, Tasha O, hi everybody. Bay was asking why there's no sound. I hope you can hear us now. Yeah, you okay? Right. Eileen, hi Eileen. Okay, Min Farahani has a question.
Sure.
Yeah, she says good day to us. What exercises increase bone density besides walking?
Sure. Now, exercises you divide into two in your case. One is a weight-bearing exercise. Weight-bearing exercise is like running, jogging, jumping, skipping. These are weight-bearing exercises. And you have non-weight-bearing exercises. Non-weight-bearing exercises is swimming, cycling. In your gym, you have the cross trainer.
Yeah.
These are non-weight-bearing.
Yes.
But non-weight-bearing exercises, I normally prescribe it to patients who are obese and who
Right.
have pains.
Okay.
But weight-bearing exercises are actually very good. They actually increase your bone density.
Right.
So when in fact us walking
Yeah.
improves the strength of your bone.
Okay, okay. So even if you can't jog or you can't exercise, you're not a runner, I think probably walking is good enough.
Brisk walking is very good.
Right.
20 minutes a day.
Okay.
If you can't do it every day in a week, 3 times a week will be good enough.
Okay.
Or a simple term that nowadays people say is 10,000 steps a day.
Yeah, yeah.
If you can keep 10,000 steps a day, you're probably doing just fine.
Yeah, yeah. 10,000 steps is about 6 to 7 kilometers.
Yes,
I think,
that's
per
right.
day, yeah.
Yes, that's right.
How about what's your recommendation on walking up and down the stairs? Do you think that's more impactful?
Up and down stairs, I think is more of a cardio workout
Yeah.
rather than it uses more energy on your body,
Yeah.
but probably not so great on your knees.
Okay.
So if you have knee problem, going up and down stairs is not so good. You end up having patellofemoral arthritis.
Wow.
So you can get knee pain.
Okay.
So everything in moderation, I think is fine. So you do a little bit of flat ground
Okay.
and then do some up and down because you need cardio as well.
Okay. Okay. Great, Mona. I think we've covered a bit on the knee. Maybe we go to the spine. I think the spine is your backbone, and I think it's basically what you call as the pillar or the foundation for the human body. So I think a stress on the back, those who complain, I have a severe backache, pain, and so on. Some of them have to be on chronic medication for painkillers as well. And unfortunately, Mona, I see those patients as well because they have severe gastric irritation and pain. So what's your thoughts on the spine degeneration because of overweight or obesity and so on?
Well, the degenerative process is the same wherever it occurs.
Right.
Spinal problem is most times is because it starts off as a postural problem.
Okay.
That means from young you're probably not taking care of your posture.
Yes.
After that it becomes part of your job,
Right.
the way the kind of work that you do. People
Yes.
who lift things, heavy weight,
Yeah.
it's worse.
Yeah.
And even later when you retire and all that, because you already have spinal problem, right? It becomes worse. They degenerate.
Okay.
So having now a lot of patients who have spinal problem have a large abdomen.
I see. Yes.
So your large abdomen
Yeah.
pulls the spine in front.
Right.
So it increases the curve that you have at the back.
Yeah.
Right? So if you don't decrease this way, the pressure on the back is because
Yeah.
the spine has joints, we
Right.
call it the facet joint.
Right.
So the facet joint is under pressure because it's being pulled
Yeah.
in front. So when you decrease the weight, right? So rather than taking a painkiller,
Yeah.
why don't you try decreasing your weight?
Yeah, it comes back to that.
Yeah. So that's what I tell them. But
Right.
even again, people with spinal problem, the best exercise is swimming.
Okay.
So whoever knows how to swim,
Yeah.
if they can swim every day, you will never regret it. You'll have a beautiful body cut,
Yeah. Yeah.
right? You lose your weight.
Yeah.
It also works on your cardio,
Yes.
right?
Yeah.
So it's an excellent exercise
Yeah.
to do.
all-round benefit, I think.
Yeah, it's a very, very good exercise.
I think a lot of us never look at it. I mean, we in the medical field, we are quite comfortable in seeing the human posture. So we know that the spine actually is not straight. It's actually bent. We have something that's called as a natural lordosis, where it bends forward and goes backwards. And unfortunately, for like Mohana has said, those who have central adiposity or obesity, the deposition here will cause you to kind of overcompensate in certain ways. So similarly, those who watch, who use the iPad or anything or handphone, they tend to bend down quite a bit, especially our youngsters nowadays. So I had one mom who actually came to me and told me that her son is starting to have neck pain. Yeah. What's your comment on that, Mona?
I see it very often on a daily basis.
Wow,
On a daily basis,
and
not only children,
Right, right.
mostly adults who
Right.
work on the computer
Okay, okay.
because of the posture. So, just like anything else that you do, if you look at it as a car, if you have a car, you warm up the car, you drive the car, you
Right.
take care of the car. When have we ever thought of taking care of our neck?
Yeah, never.
Never. You use your computer and your handphone, your smartphone all the time, but we never think of taking care of it. So most times when they start having problems, the first step is a lifestyle modification.
Correct.
And then after that, we teach them, we send them for physiotherapy to teach them how to do this posture exercises. So every few hours they are on the computer. Your job may require you to be on the computer.
Yeah.
So we teach them how to do certain exercises to keep their muscles here strong, so the neck doesn't actually fall front.
Right, yes. I think posture is very, very important.
Very
Mona.
important.
Yeah.
Yeah.
The diseases that we are seeing, our youngsters and everything suffering from, is totally preventable. So it's just
Yeah.
some form of education as well as some precaution on that, so
That's
probably
true.
will be helpful, right? We take a few more comments, Mona. So Jalin Lau, yes, hello. Tina Lestari, welcome. Annie Boone, hello. Carolyn Mata says good quality in the best hospital, love it. Jumiati Lestari, yes, thank you. Tina Lestari. Mike has a very nice recommendation as well. Puji Utomo, thank you so much. This hospital is really recommended. Visit Gleneagles. Yes. Thank you for your feedback. Okay, so Mona, when we've covered the knee, the spine, how about let's go to the foot and the ankle? I think that's your specialty. Ms. Mona is a subspecialist in knee and ankle joint. So I'm sure you have a lot to say about that part of the.
Yeah, I could probably speak the whole day on foot and ankle. It's my passion.
Great.
So, well, one thing that I want to put forward, I would let you know, is that from the time you are born until we die, we would have walked 4 times around the earth.
Wow, I never knew that.
Yeah, that much of energy, that much of weight the foot has taken. Right? It takes that much. Whereas if you have a car, you will change the tires how many times? Your wheels, you will change it so many times. But there, it is. So, the weight of your body, it's up to you whether you want to keep it low, right? To manage your aches and pains, right? So your body can take quite a bit of beating. But if it tells you that it is in pain, that means something is not right. We got to do something about it. If it's preventable, you got to prevent it.
Well said, yes.
Right?
Yeah.
But it's not always that easy because not everybody who's obese hasn't done anything.
Yeah.
So that's where I think your role comes in.
Correct, Mona, because I think when we talk about obesity as well, as our viewers know, so you're not going to go to the hospital and say, Doctor, I'm obese. Not all of our patients do that. Normally they will present either, like Mona has said, because of ankle pain, knee pain, back pain, or because of diabetes, hypertension, any other disease that is associated with that. Coming to the foot and ankle, Mona, if let's say a patient, because of their toes, or there's a lot of reasons why you can have pain in your foot. One is because of a poor blood supply. We call it claudication pain, where the blood supply, because of the nutrition that is supplied to the toes and to the ankle is not enough, and it causes a severe gripping pain.
Yes.
So how do patients know whether the pain is because of the bone or because of the muscle or because of the nerves? Especially nowadays, our diabetic cases also are increasing. So probably you can tell us something about foot care and what should our viewers
Sure.
be concerned about?
Sure. Well, the patients will never know why it's painful.
Exactly.
Just like if you have a headache, you will never know why your head is painful.
Yeah.
But if you have pain every day,
Yeah.
something is wrong. If you have pain more often than not,
Yeah.
something is probably wrong.
Right.
Right? You should come and go and see somebody. So pain in the feet can be one. It can arise from the feet itself. That means problem is in the feet.
In the feet, yeah.
Or it can arise from elsewhere, some other system, like what you're saying,
Right.
your blood system,
Yeah.
or from your nervous system, which is your electrical system of your body.
Yes.
So you can have a problem on the back,
Yeah.
right, where the nerve is being impinged,
Yeah.
but it's causing you pain in the little toe.
Yes, I see.
You can have like
Yeah,
that,
yeah.
right? But generally, nerve pain, you will have numbness
Yeah.
or weakness, right? Bone pain will be deep pain, and if you have if your artery, your vessels are blocked, it will be pain when you sleep at night. You cannot sleep. You start hanging your leg down.
Yes, correct.
You will hang your leg down.
Rest pain, yes.
Rest pain. You will have rest pain. But well, you know that there can be hundreds of causes
Yes.
of having pain in the leg. But foot care, I'll put it in one very simple way. Take care of your feet like how you take care of your face.
Wow. Well said,
Right?
yeah.
If you do all, put your lipstick and you get up in the morning, you take care of your teeth and your face. If you're not doing that to your feet, probably you're not giving it enough care.
Actually, it's well said, Mona. I think a lot of us don't take that same amount of extreme care like we take for our face, because the part that we get looked at most of the time, and most of the time our foot is you're wearing shoes or socks or anything. So like you said, I don't think so many people are taking good care of their feet.
So cream your feet, take good. It's fine to go for pedicure.
Yeah,
Since you go for facial,
Yeah,
it's
yeah.
alright to go for pedicure. So take care of your feet like how you take care of your pretty face.
Wow, that's great advice. Another thing, Mona, I think why we wanted to highlight this, I think is very important, because whenever someone has any pain, the reflex is that take a painkiller. So a lot of our viewers also will have that same experience where family member or acquaintance or someone is actually polypharmacy treating themselves at home.
Yeah.
And I think when you do not find the root cause of what is happening down on the most important, like Mona said, in our lifetime we have probably walked around the earth 4 times. So that amount of stress is a requirement. We need our feet to do our daily work. Otherwise, can you imagine lying down the house and unable to walk? It's a luxury. So if you don't take care and you let it happen at a later time, and by the time when you go and see Dr. Mohana, probably by the time he diagnoses the problem and all that, you have already caused a very severe destruction to your anatomy, either the bones or the muscles and so on. So I think it's very important, like he said, that you should take care of your feet, and you should address any issue related to pain or anything, and try to get expert help and see what is the cause, right?
Yeah.
Okay, Mona, we have William Tugadi. Hello, William. Kalau mau melakukan pencegahan osteoporosis dan osteoarthritis. So osteoporosis and osteoarthritis, maybe you can say something, how to differentiate the two, and what are the effects?
Osteoporosis is not a disease, it is a condition. So osteoporosis is something that occurs naturally. So you see, when you're young, you form more calcium, and the calcium that is thrown out is less. So as you age, as you menopause, the amount of calcium that forms is less.
Yeah.
So your bone is the same.
Yeah.
It's just a bit more fragile.
Yes.
Right?
Yes.
So instead of it being compact, it's less compact. That is osteoporosis.
Osteoporosis, yes.
Right? That means the bone is still good bone, but it's just fragile, it's brittle.
Brittle bone, yes.
Brittle.
So there's more chances of having a fracture?
Yes, if you have a fall, you can fracture.
I see.
That's why old people, even they
Yes.
just have a slip and they have a broken bone in their hip and all that. That is osteoporosis.
Okay.
If now I may be having osteoporosis. Okay, let's say I'm 70 years old.
Yeah.
I'm 30 now. Okay, that's a joke. Alright. So
You look 30.
so let's say I'm 70
Okay.
and I can have osteoporosis and I won't know it.
Right.
I won't have any pain.
Yeah.
But osteoarthritis is a problematic condition.
Yes, yes.
It is degeneration of your normal cartilage.
Okay, okay.
Your cartilage actually degenerates.
Yeah, that's
So
right.
that will be painful. You will present with pain, stiffness, swelling.
Okay, okay.
So osteoporosis, the pencegahan that he said,
Yeah.
pencegahan is keep your weight down, weight bearing exercises, get enough sunlight, right? Calcium intake,
Okay.
right? Something like that.
Yeah.
And osteoarthritis, right? You'll see there's something that's it's the same for both.
Yeah.
Weight reduction,
Same. Yes.
osteoarthritis. Right? I'll tell you a little bit more about osteo. So
Okay.
osteoarthritis is weight reduction,
Okay.
right? And treatment of the pain that I had told you earlier, the
Yeah.
whole step.
Yeah.
If you want to look at osteoarthritis in a simple form,
Yeah.
right? You look at it, let's say you have your car.
Yeah.
Your car is designed to have 4 passengers. Maybe you would have taken 5, at times you would have taken 6.
Yes.
But if you take 10 passengers every day,
Yeah.
it's going to only last you for 4 years instead of maybe 15 years.
Yeah. It's very true. Very nicely put. Yes.
Yeah?
Yeah.
So if you overuse and put too much weight on the car, every component of it, your shock absorbers, your wheels, your engine is working harder, which is your heart.
Yeah. Correct.
Right? So it's that whole thing. So that's the way of looking at it.
Yeah, actually, you made it very a clear point of view. When you put the burden on the vehicle, so much of stress, we can see, and we take good care of our car, especially. We spend so much on it, and unfortunately, our not everybody, but a lot of us, because of our nature of job and so on, we don't take care of our health as much as we want to.
That's right.
And when you have that problem, then only you come running to Mohana, and probably that's the time that you're expecting to work a miracle on you. So I understand what you're saying also. So I think hopefully we get the message across, and people will understand that you have to remain healthy, not only for yourself but for your family. I think it's very important.
Yes.
Okay, we have okay William, yang kita sudah sharekan tadi yang swimming adalah exercise yang sangat bagus untuk seseorang untuk mengurangkan berat badan dan maintain juga, dan untuk posture untuk tulang. Okay, and he's also asking bagaimana melakukan posture tubuh yang bagus dan benar kerana saya bongkok.
Yeah.
Yeah.
Well, I think what we do is, in his case, saya rasa William, is it?
Yeah, William. Yeah.
William, saya rasa William kali pertama saya rasa William lebih baik jumpa seorang pakar physiotherapy.
Yeah.
Let him see a physiotherapist.
Physiotherapist.
So
yes.
they will teach you posture,
Posture.
right? Maybe he will need to see a doctor first, see why it is bongkok in the first place. Is it a problem with the bone? Because when he says bongkok, it can be kyphosis.
Yeah, yeah.
For all you know.
Spine disorder.
Spine problem. Kalau tiada masalah dengan spine, nanti boleh jumpa seorang physiotherapist untuk membantu.
Yes. Okay. And then tentang biaya for hip replacement and knee replacement, I think you can rujuk kepada kita punya website untuk tahu package yang ada di sana. Yeah. Okay. Okay. So very good discussion today, Ms. Mona. We're coming towards the end of our program today. Another parting this one. I think we will try to address another issue also. Maybe something about bone cancers, Mona. Do you find that bone cancers are increasing as currently?
Well, we can say it's increasing because I think we are detecting more.
Okay.
People come earlier.
Yeah.
Previously when they come very late.
Yeah.
It's already too big.
Correct.
So bone cancers, you can put it in two forms.
Yeah.
One is either it's a cancer from that region itself,
Yeah.
or it's a cancer from elsewhere. Maybe you
Yes.
have a breast cancer,
Correct.
thyroid cancer,
Yeah.
colon.
Yeah.
So cancer from elsewhere, and then they go to the bone.
Yeah. We call it metastasis.
Metastasis. They go to the bone. So if sometimes when they have pain, that's the reason at times we have to do certain imaging,
Yeah.
X-ray, MRI, to see whether the problem is in the joint or is in the bone. If it's in the bone, it can be infection, it can be a cancer.
Okay.
So I think we see more now because we are picking up more.
Okay, I see. Okay. Okay, Mona, I think it's been a pleasure to talk to you and I think I just have another question. Like when we're talking about breast cancers, like you mentioned just now, we have a screening that we can do like a mammogram, or for prostate cancers we can screen with PSA levels and so on. So if let's say a patient wants to take care of their bones, do you recommend any sort of like a screening tool, or how do they go about to probably a yearly checkup to check their bones, or but is there anything that they can do?
I think in clinicals we already have a very nice package system
Right.
where they do it's called Premier. I think they do everything.
Okay.
So the PSA and the mammogram,
Okay.
ultrasounds and all are already in there.
Okay.
So they come for a yearly checkup.
Correct. More in terms of the bone for
No.
Yeah.
Also the DEXA scan is also part of it, but I do DEXA scan every 2 years if it's
Okay.
required.
Right.
I don't like screen everybody,
Okay.
but I do a DEXA scan. If they are not in the group that is osteoporotic group, I don't do it.
Okay.
Otherwise, if they come with a problem and I think they need one, I do one, and then I see another 2 years.
Okay. Any special advice for women who are menopausal? Is there anything that they should be afraid of in terms of osteoporosis, anything?
Well, it's what I just told you earlier. Keep yourself fit,
Yeah.
keep yourself healthy, keep doing your exercises. Don't be scared to don't be scared of the sun.
Yes.
Go out in the sun,
Correct.
right? At least 20-30 minutes a day. It's not wrong to actually shop in the sunlight,
Okay.
and keep up with your exercises, and you should be alright. You don't need all these supplements, extra supplements, unless a doctor prescribes it to you.
Okay. Fantastic. So you heard it here today, folks. Our take-home message is very simple. Sooner or later, because of as age progresses and so on, you will have some form of debilitating disease that affects your bones because of age-wise. But if you are obese or overweight, this will accelerate faster. So you got to take precaution. Watch your healthy diet, as Dr. Mohana has said, and keep your foot and ankle, keep it healthy. Do your 10,000 steps a day, right? Eat nutritious food, I think rich in calcium, a balanced diet. You don't have to be too extreme. There are a lot of diets available. You have this Atkins diet, you have the South Beach diet, so many different types of diets. So just maintain a healthy and a balanced meal. I think that's important. Mona, you have any parting requests or advice for our viewers today?
No, I think I would like to thank all of them for being with us.
Yes.
Be very kind of them to actually join us today. So I hope that you all have actually picked up something.
Yes.
And stay safe, stay healthy, and we'll see you again in the next round.
Okay. Excellent, Mona. It's similarly, I also would like to say the same thing. Thank you all very much for joining us for today's program. I'd like to thank Dr. Mohana for spending his time at his lunch hour actually to come and join us here. All of you all, stay safe, stay healthy, and we hope to see you all again next week.